Supporting families and access to care. President Biden strengthened the care economy, including by enhancing the supply and quality of care, boosting job quality for care workers, lowering costs, advancing care as a support service, supporting family caregivers, and improving access to home-based care for veterans. President Biden and his administration secured $39 billion in funding for child care, the largest one-time federal investment ever in child care through the American Rescue Plan. This helped keep over 225,000 child care providers open and available, serving over 10 million children. It brought hundreds of thousands of women with young children into the workforce faster, lowered child care costs by an average of $1,250 per child, and increased wages for child care workers by 10%. Delivered $37 billion in American Rescue Plan funds across all 50 states to enhance, expand, and strengthen home and community-based care, and $145 million to help the National Family Caregiver Support Program to deliver counseling, training, and short-term relief to family and other informal care providers. Increased funding for the Child Care and Development Block Grant Program, the major child care grant program, by almost 50%, bringing the number of low-income children served from 1.3 million in 2021 to 1.8 million in 2024. Capped out-of-pocket spending on child care to 7% of household income under the Child Care and Development Fund program, saving about 100,000 families over $200 a month on average. Signed an executive order on increasing access to high-quality care and supporting caregivers, the most comprehensive set of actions any president has ever taken to improve care for families while supporting care workers and family caregivers. Increased pay for Head Start teachers by an average of $10,000, a key action to achieve equitable pay and improve quality and stability in Head Start programs. Lowered child care costs for military families. Ensured that more than 140,000 child care providers are paid more fairly and on time. Established minimum staffing standards for nursing homes. Took steps to ensure that home care workers get a bigger share of the Medicaid payments. Introduced a requirement that companies receiving CHIPS and Science Act grants over $150 million create a plan to ensure access to quality, affordable child care for their employees. More than 3/4 of all companies that have signed CHIPS awards or preliminary memoranda as of December 2024 were working to provide child care offerings for their workforce, including many grant applicants who are doing so voluntarily. Increasing food access and improving nutrition. President Biden fought to lower food prices, including by calling on grocery chains to lower costs for consumers and increasing food assistance for families in need. President Biden updated the Thrifty Food Plan for the first time since 1975, resulting in an increase in Supplemental Nutrition Assistance Program (SNAP) benefits of 21%. Increased it by 21%. This kept an estimated 2.3 million people out of poverty, including nearly 1 million children. Invested $390 million in American Rescue Plan funding to support outreach, innovation, and modernization of the Special Supplemental Nutrition Program for Women, Infants, and Children, also known as WIC. Held the first White House Conference on Hunger, Nutrition, and Health in 50 years, garnering $10 billion in external commitments. Completed over 150 federal actions focused on ending hunger and reducing diet-related disease. This includes a proposal rule that, if finalized, would require a label on the front of food and beverage packages that indicates if an item is high, medium, or low in added sugars, sodium, and saturated fat, updating the criteria for foods and beverages to use healthy on their labels. and galvanizing the food as medicine movement. Finalized a rule to make school meals more nutritious, including the first ever added sugar limit in school meals. Launched SunBucks, the first permanent nationwide summer grocery benefits program through which nearly 21 million children received $120 in grocery benefits in the summer of 2024. Reproductive health. The Biden-Harris administration took unprecedented executive action to protect access to reproductive health care after the Supreme Court overturned Roe v. Wade. The President and Vice President called on Congress to restore the protections of Roe in federal law, and President Biden signed 3 executive orders and a presidential memorandum during his administration to protect access to reproductive health care. Over the last 4 years, the Biden-Harris administration took action to protect access to safe and legal medication abortion. Access to medication abortion was a key administration priority since the day the Supreme Court overturned Roe. As a result of a new pathway established by the Food and Drug Administration in 2023, medication abortion can be prescribed by telehealth, and many pharmacies across the country, including major retail pharmacy chains, are now certified to dispense medical abortion. On what would have been medication abortion. On what would have been the 50th anniversary of Roe, President Biden issued a presidential memorandum directing agencies to consider further efforts to support patients, providers, and pharmacies who wish to legally access, prescribe, or provide medication abortion. Defend FDA approval of medication abortion in court. The FDA and Department of Justice defended access to mifepristone, a safe and effective drug used in medication abortion the FDA first approved more than 20 years ago, in court, including in a lawsuit before the Supreme Court that attempted to curtail access nationwide. Defend access to emergency abortion care. The administration fought to ensure that women who are experiencing pregnancy loss and other pregnancy-related emergencies have access to the full rights and protections for emergency medical care afforded under the Emergency Medical Treatment and Labor Act, including abortion care when that is the stabilizing treatment that is required. The Department of Health and Human Services took comprehensive action to educate patients about their rights and to help ensure hospitals meet their obligations under EMTALA, including guidance to affirm the administration's view that EMTALA preempts conflicting state law restricting access to abortion in emergency situations. A new way for individuals to file an EMTALA complaint, new training and educational materials, and a dedicated team of experts to support hospitals in complying with EMTALA. Partner with state leaders on the front lines of abortion access. The White House partnered with leaders on the front lines of protecting access to abortion, both those fighting extreme state legislation and those advancing proactive policies to protect access to reproductive health care, including for patients who are forced to travel out of state for care. Vice President Harris led these efforts, highlighting the harm to women's health at more than 100 events in more than 20 states and meeting with hundreds of state legislatures, healthcare providers, and advocates. Defend the right to travel. On the day the Supreme Court overturned Roe v. Wade, President Biden reaffirmed that women must remain free to travel safely to another state to seek the care they need. In November 2023, DOJ filed a statement of interest in 2 lawsuits challenging the Alabama Attorney General's threat to prosecute people who provide assistance to women seeking lawful out-of-state abortions. DOJ had continued to monitor states' efforts to restrict the constitutional right to travel across state lines to receive lawful health care. Expand access to affordable, high-quality contraception. In response to directives from President Biden, the administration rebuilt the Title X Family Planning Program and improved contraception access and affordability under the Affordable Care Act. through Medicare and Medicaid, through federal health centers, and for service members, veterans, federal employees, and college students. The administration did so at a time when abortion bans disrupted access to critical health services, including contraception, as healthcare providers are forced to close, and as contraception access was under attack in states and in Congress. Support access to fertility care, including IVF. In the face of extreme attacks on fertility services, the administration supported access to fertility care, including IVF, for service members, veterans, and federal employees. The Departments of Defense and Veterans Affairs expanded eligibility for IVF services for certain service members and veterans, helping them build their families. And the Office of Personnel Management significantly expanded access to IVF benefits and coverage to support federal workers in growing their families. Strengthen reproductive health privacy. HHS issued a rule to strengthen reproductive health privacy protections under the Health Insurance Portability and Accountability Act, HIPAA. This rule prevents an individual's information from being disclosed to investigate, sue, or prosecute an individual, a healthcare provider, or a loved one, simply because that person sought, obtained, provided, or facilitated legal productive health care, including abortion. The administration also took enforcement actions against companies for disclosing consumers' personal health information, including highly sensitive reproduction health data without permission. Next will be pandemic preparedness.